Welcome back. Now, when it comes to screening mammographies, there's a lot of misinformation floating out there, but our next guest is here to separate fact from fiction. Dr. Amanda Bagby, she is the breast screening and prevention internist at Baptist MD Anderson, and she's here to let us know a little bit more about all the misinformation that's floating around out there right now. So can you tell us, is it true, just starting off, that your risk or chances for getting breast cancer increases with age?
So, first of all, thank you for having me.
Yeah, we're glad that you're here.
Yes, actually, so your breast cancer risk is greatest between the ages of about 55 to 64. We actually see that about 80% of all breast cancers occur in women after the age of 50. So that's when you're at your highest risk for the majority of people. Obviously, younger women can get breast cancer as well, but it's usually over age 50 is when we're seeing it.
Interesting. So what about women that actually have implants? Are they able to still get screened?
Absolutely. So women with implants still have breast tissue, and they are still at risk for breast cancer just like any other woman. When you have implants in place, your technician who's doing your mammogram should ask if you have implants before you do your study. And what they'll do is they will do special views and different positioning to really see the breast tissue better around your implant, and it really should be as good of a study as if you didn't have implants. So women with breast implants absolutely need mammograms just like everybody else.
Well, there you go. That's just more information that's floating around there that you might or might not know is true or not. But mammograms in general are kind of the standard when it comes to like screening for breast cancer, but there's so many different kinds out there. Can it detect all cancers?
So no, like any screening test out there, it is not 100% perfect. Mammograms can miss breast cancer, and a lot of it depends on a couple different factors. So when women have more dense breasts, the mammogram tends to be less sensitive, and the women who tend to have more dense breasts tend to be younger. So in our younger patients, say between the ages of 40 to 49 or so, in patients who have breast cancer, mammograms will miss about 25% of those breast cancers in younger women. In women over the age of 50 who may have less dense breast tissue, mammograms are going to miss only about 10% on average of those breast cancers. But like anything, it's not a perfect study, which is why it's so important to be meeting with your doctor regularly and doing self-breast exams and having your clinical breast exams done as well.
So it's really a full range of stuff that you should be doing in order to prevent it, not just relying purely on mammograms.
Absolutely, absolutely. And there are certain women who are at a little bit higher risk than the average population too, and that's where we'll sometimes add in additional imaging options for those women if they're considered what we call high risk.
Yeah. So technology's obviously come a long way with, you know, breast cancers and just in general, but there's 2D and there's 3D. Can you tell us what the difference is between the two of them?
Yeah, so 2D mammograms are more of the standard, traditional, what's been around forever type of mammogram. And that's where your breast radiologist is going to get essentially two views of your breast tissue from different angles.
Gotcha, okay.
And the newer technology, the 3D mammogram, it's also called mammogram with tomosynthesis. What happens is the tomosynthesis machine takes a number of different views. The machine actually kind of rotates and it'll take a number of views, and then it feeds it into a computer and creates sort of a three-dimensional model of the breast tissue for the radiologist to view. And what that does is that decreases the amount of false positives that you'll see.
Interesting.
So it's more accurate. So you have fewer callbacks for abnormalities seen on your screening mammogram. The radiologist can get a more detailed view of the breast tissue, and they also can see more of the breast tissue than we could on standard 2D mammography. So we find that the 3D mammograms are particularly useful in women who have very dense breast tissue, where we might not get as good views otherwise. And so that's something that you can talk to your primary care provider about which type of mammography would be best for you.
That's really interesting. So much information to be learned out there and tossed to the side on top of that. Is there anything, I guess, that you have seen just in your profession that's a common misconception or a common myth that we might have not touched on today?
No, I think it's important for women to, number one, don't be afraid of getting your screening mammogram. They are only mildly uncomfortable for most women, and the radiology technologist can really do some good positioning moves to make it better for you. but they're really important to get your screening mammogram. It's also important to do your self breast exams. When women examine their breasts themselves on a regular basis, they learn what their breast tissue feels like.
Right.
And they are more likely then to identify a spot or a nodule or a change in what their breast tissue had felt like before.
Yeah, that makes perfect sense.
Yeah, and
Thank
then it's
you so
also,
much.
well, it's important, one more thing, to just have your clinical breast exam. Your doctor needs to be performing your breast exam as well.
Well, thank you so much, Doctor. This information has been very beneficial, especially for anyone that might be watching. And a special thanks to Baptist MD Anderson for sponsoring this segment. For more information, you can visit baptistmdanderson.com or simply give them a call at 1-844-632-2278. You can also find them on Facebook on their page, Baptist MD Anderson.